I think it should. Okay. All right, we're live. We're live. We're here on YouTube's. We're here on Instagrams. We're adding S's to everything today. That live was wild. I'm glad you liked it. So before you go back, we talked about parasites on Wednesday. You can check it out on my Instagram. Um, yeah, I might put that one in my actually on the membership. That's actually a really good idea. I'm gonna download that. I might actually upload that to YouTube too, but I will put it on the in the library for free. But I want to get it up and running and working first, so I'm gonna do that. So a little bit of housekeeping before we get started. Happy Friday. Good to see you. I will be launching the Inside Out Healing Inside Out library. That's going to be launching hopefully next week. I'm working on all the back end stuff. There's going to be a community. There's going to be courses which you could purchase, or you could become an inner circle member and you get access to all of it, all the courses I've ever done, all my protocols, etc. Live sessions with me every week. So, depending on where you are on your healing journey, if you're trying to get out of chronic aches and pains, that's going to be the way to do it. Peachy, that's going to be the way to do it. So once this membership launch, once the free community launches, there's going to be a way to upgrade into the inner circle. You can ask me literally whatever questions you want. I will cover them on live sessions, but that's where it's going to be. It's not going to be here on social media because of certain things that we can say. I want to keep my channel on Instagram. I want to keep my channel on YouTube. A lot of the stuff I'm hosting is here, so I will play by those rules. But off of that, I can answer those questions more directly. There will be an answer to that question starting next week, I promise, because that is my goal this weekend, is to get that up and running. I'm like 80% of the way there. I just need to create all the tutorial videos. How do you use this? It's going to function a lot like a Facebook group. If you're already an inner circle member, you shouldn't have to purchase. I'm going to try to figure that out again this week. And if you've already purchased a course from me, you should get access to it. I will be sending over invitations to migrate everything over from the platform I'm using to the new platform. But for everyone new coming on, it's going to be super straightforward. So it's going to look like a Facebook group, but it's not on Facebook, I guess is the easiest one way to do it. It's going to be on this platform called Skool, Skool. But again, there will be much more information on that once the ball gets rolling. Okay, let's talk about joint pain, aches and pains. I want to start this by talking about osteoarthritis a little bit. So these numbers are a little dated. They were like in the middle teens, I'd say. OA was affecting at that point 27 million Americans, which is almost 1 in 10 people. Again, we're not talking about osteoarthritis specifically, but it's important to notice because we have this concept of as we age, we break down, we wear and tear. And if you look it up on a lot of websites, age is a reason why arthritis develops. And I want to say that's not necessarily true. Our lifestyles will do that, will age us quicker, but that's an important kind of concept to understand. And we talk about that all the time. And I want just keep this in mind as we go through it. I know I repeat myself on this all the time, but there are 5 keys to regeneration and reversing disease, right? How well you assimilate nutrients, how well you excrete waste, are you able to grow, are you able to reproduce, and your ability to adapt. And if you are doing things that are going to increase those things, you will be able to heal. If you're doing more things that put negatives in those columns, you will start to degenerate. It is that simple. Are you improving your ability to assimilate nutrients? Are you improving your ability to get rid of waste? Are you improving your ability to grow, build new cells? Are you improving your ability to reproduce at the cellular level, on a species level? Or your ability to adapt? Are you resilient? When something is thrown your way, can you adapt? Or is that stress going to break you physically, mentally, emotionally, spiritually? So why is this important when it comes to pain? Well, let's talk about joints for a little bit. A joint is simply a place where 2 bones come together, and cartilage is essentially this tissue that connects it. Now, technically, we have 3 different types of joints, broadly speaking. We have fibrous joints, which are bones that are connected by fibrous tissue. So think about, so a lot of people don't recognize this, but the bones in our skull is not one bone. It's a bunch of different bones that are connected by this fibrous tissue. Our skull bones actually move. So with inspiration and exhalation, the bones in our skull will actually move. And if you actually, feel, and have some touch, you will notice that. Then we have cartilaginous joints. Now, cartilaginous joints, these are bones that are connected by fibrocartilage or hyaline cartilage. They allow a little bit of movement, not a ton. And then we have synovial joints. These are the joints you think of are the ones that kind of move. So the knee is usually an easy one. All the joints in our fingers, these are synovial joints. They're not directly connected. There's a synovial fluid which acts almost like a cushioning that's inside a joint capsule. So you have two bones like this, and there's a capsule around it on both sides, and in between is fluid, and that acts like cushioning. So that's going to provide the compression of loads, say when you're kind of going through something. So that's important to kind of, keep in mind here. Now, inflammation is a big thing when we're talking about joint pain or osteoarthritis, and it's important to kind of keep this in mind for a few reasons. One is we kind of think it's like this progressive disorder, but what's happening is we have different things in the synovial fluid. There are things like glycosaminoglycans, or they'll be shortened to GAGs. Fantastic name, GAG. And when you lack these GAGs, you might start getting some wearing away of cartilage for a variety of reasons. So again, go back to those, those keys to regeneration. It's an inability to assimilate nutrients. We lose some of these GAGs. Now we have weakened joints. And that can happen from physical, chemical, or emotional stress. So let's take a neck injury, or even better, let's take a carpal tunnel. So carpal tunnel, if you don't know, it's usually like you'll get pain in the wrist, sometimes in the hand. And what I find most times is we actually have this plexus. So it's interesting. When you look at chakras, we have 7 chakras in our body. And when you actually look at where these are located, they're actually located by different big nerve plexi, I guess, technically in the body. And if you actually look it up, it really kind of maps out that way and works. So like we have the lumbar plexus, that would say be like our sacral chakra. We have our enteric nervous system that's associated with our solar plexus, and that is responsible for digestion. So there's a lot of different like anatomical and energetic components that all match up. But let's take the brachial plexus for a second here. Say we're working with carpal tunnel. I got wrist pain. I got hand pain. I don't know what's going on. Now there's a connection. We have this brachial plexus, which is a bunch of nerves. And usually it's going to be C5, 6, 7, 8, and T1. They kind of all, I know, have 4 fingers, but they kind of come out of the neck and the spine, and they go all the way down the arm in a variety of ways. And that's what innervates your arm. I can move my arm. I could flex. I could extend. I could move my fingers. I could ulnar flex. I could radial flex. I could flex forward, extend, do all those things. With carpal tunnel, though, some of those movements might be a little bit painful. Now, most of the time, what ends up happening, especially with this, is if you have carpal tunnel for a while, you might go to a hand specialist, and they might want to do a release. There's a retinaculum that covers this, and they might want to cut it so that it frees up. Problem is, if the nerve is inflamed, it's going to come back over time. And this is why you'll hear why carpal tunnel surgeries, quote unquote, fail. It's because they don't fix the issue. What's the main issue that comes with this? Well, if you're having chronic pain to any joint, and in this case, we're talking about the wrist, it is compromised blood or nerve supply to that area. So you have to ask yourself, is the blood healthy enough to supply what is needed to the area? If not, there might be inflammation. B, is the nerve supply impinged? Now let's talk about the nerve supply first. Imagine, again, those nerves come out the neck, go into the arm, all the way down to the wrist. What if, happen to sit at a desk all day, we have our neck kind of forward like this? Is that going to compress where those nerves come out? And if we constantly have this forward head carriage, if we're constantly leaning over, is that going to potentially impinge on those nerves that cause wrist pain? Yes or yes? Yes. Try to make it easy for you. And most of the time, what I see happens, like these problems actually originate in the neck. And you don't even need an x-ray many times to see this. You can see this by looking in the mirror and seeing where your neck stands. Like if we don't have that nice reverse C curve, chances are that's going to be off. That's going to be causing your wrist pain. So, and this is without getting into nutrition, emotional stuff, etc. Like you have a lot of people, say you have two grocers who do the same job. They're moving items from right to left, onto the belt so they can pack them. One guy has wrist pain, the other guy doesn't. They're doing the same work. So it's not a repetitive motion thing. It's not a wearing out, quote unquote, of joints. It's something going on um, that's causing the inflammation. And it's either lack of nerve supply or poor blood supply, i.e., not clean blood, not enough oxygenated blood. And that leads to ultimately inflammation. The nerve gets inflamed. You have pain, say in the hand, in this case. So we have to go back to what that is. Now, there's plenty of ways. So this is where like the physical structural component is so important when we're talking about chronic aches and pains. Now, what's going to happen, say, if you have this chronic forward head carriage for a long period of time? That could be a lot of things. Yeah, carpal tunnel syndrome's one. Could be headaches, could be shoulder pain, could be rotator cuff, could be high blood pressure. Why? Because a lot of those nerves close there are also controlling the heart. You know, it could be bursitis. It could be other types of neuropathies. It could be asthma. It could be different forms of cancer. If you're constantly cutting off that blood supply, is that going to be an issue? Yes. So, question is, how do we fix this, particularly with posture? And this is really important because it's not under conscious control. So we have a lot of tiny muscles that we don't necessarily talk about that connect essentially the vertebrae. They run from vertebrae to vertebrae. These are not under conscious control here. So we have, it's actually called proprioception. It's our ability to understand where we are in space. In other words, if I close my eyes, I still know my right hand is here. I can find it with my left. So if I move my right hand here, I know I can touch it here. Here's my hand, even though my eyes are closed. That's proprioception. So it's really important to kind of understand that. So we have these dorsal columns, we have the cerebellum, and then we have what's known as the vestibular ocular system. Now, the ocular, as you might understand, is our eyes. Our vestibular system is actually found in our ears, also in the brain, which accounts for our ability to balance and, again, find where we are in space at any given time. So same thing. So like if I can, close my eyes, I know my right hand is here, even though I can't see it. Even though I lose that sense of vision, I still understand that, my right shoulder is here, my right elbow is here. I can do that even though I can't see. So it's really, really cool, like that we actually have these systems and all of them work together. But when you cut one out, it tends to be a little bit more difficult. So when you're cutting out nerve supply, when you're cutting out blood supply to specific joints or areas, that again can lead to these aches and pains that become big issues down the road. Now, this is the point of why I kind of wanted to make the post I did this morning, because it's going to come back into it. Now, another reason, again, we talk about chronic dis-ease. So another word for inflammation actually is an acidic body, right? Is an acidic state, because in acidic states, things tend to clump up. They tend to coagulate. They tend to come together. Now, remember, we've talked about this before, that the two primary causes of dis-ease are either an acidic, an inflammatory environment, or toxic exposure. So if I have wrist pain and I'm going to like the conventional doctor's office, like chances are the first thing I'm going to get is maybe a PT script if I'm lucky, probably an NSAID of some sort. Maybe it's an Advil, maybe it's Tylenol, maybe it's, ibuprofen of some kind. All of these are going to increase the inflammatory load in the body, i.e., the acidic load, make you more acidic, and is going to actually wear down these joints over time. This is really important to understand. And if anyone plays sports, they will understand this, I hope. So I played baseball. Big thing when I was growing up was they would call Tommy John surgeries. What would happen usually is people would strain a ligament or tendon in their elbow. And then from there, what they would do, because the pitchers didn't want to miss time, they would essentially inject the area with a cortisone shot. What do? You get rid of the pain. The problem is the cortisone itself actually breaks down the joints. Remember those glycosaminoglycans, the things you need to heal, the ability to repair, create collagen is actually diminished. Usually what happens within a year, they might do a couple of these shots to eliminate pain. The joint blows out. They ultimately need Tommy John surgery because they completely tore the joint or tore the tendon. This is happening at the oral level too. If you're taking these NSAIDs, it's actually going to decrease your ability to repair. So yes, you might get short-term pain relief, but you're actually at the same time diminishing your own ability to heal. Now, add on to that exposure to heavy metals, exposure to endocrine disruptors, exposure to things like glyphosate, exposure to constantly consuming acidic foods, gluten, especially conventional gluten, dairy, seed oils. You're really putting yourself at a disadvantage when it comes to healing. And not only that, you're throwing more acid onto this inflammatory fire. It's really no wonder why that wrist is chronically in pain. So not only are we talking about a physical, a structural problem, we have a chemical component to this too. Yes, we can mask symptoms for a long period of time, but they're not necessarily going to get to the answer. And it's really important to kind of understand that, because if we want to get to the bottom of these aches and pains, we need to actually cleanse from the inside out and also address the structural components that are playing a role. And this is why, when I work with people either in person or virtually, I can show you how to do all this stuff at home and to fix this. It's very straightforward, if you do it. So that's, a really big thing. Like inflammatory foods are going to be a big part of this. Processed sugars, conventionally raised soy, eggs, vegetable oils, dairy, conventional grains, animal products, especially ones that are the conventional ones that are given antibiotics and injection residues. Like all of these are going to add to that load. And when you're throwing more of the acidic flames on an already inflamed area, it's going to be an issue. It's going to just lead to more of an issue. So yes, we have a structural component. Yes, we have, a few other things that are going on, but we have to address the chemical component of this too, or else it's not, going to go away. So, I have my notes out of order. So that's important. So collagen is also really important as well. And we're going to actually talk about some other things that we can do for this at the end. Just give me a second here. I just have my notes out of order. So collagen. So we talk about collagen all the time. Do I need to take a collagen supplement? Obviously I work in the plant-based space. So what's more important than taking collagen? Because even if you consume, say, whole collagen, or you think you're getting whole collagen from your bone broth, that's not necessarily what's happening, because you have to digest it. It needs to go into the stomach. Those collagen structures need to be broken down into the individual amino acids, then are reabsorbed, and then they might be used to make collagen in the body. They might not. Your ability to digest them and absorb them is actually probably more important. Again, you can get the things you need to make collagen exclusively from plants, which is what most people in my opinion, should be doing anyway. You can get the amino acids you need. The digestion part's really important, and that's something we're going to cover, further. But generally, there's 5 main types of collagen. There's over 25 types of collagen technically, but generally there's 5 we talk about. Type 1 is usually like skin, tendon, your arteries and veins, organs, bone. Type 2 is cartilage. It also makes up the nucleus pulposus, which is your in your vertebrae, or not in your vertebrae, but in the discs. Type 3 is also known as reticulate or reticular fibers. So these are found in like the skin and vessel walls. It's usually type 3 and type 1 are very similar. But type 4 is more in like epithelium. And type 5 is usually like your hair, your lungs, cornea, placenta, cell surfaces. There's plenty more. And again, you need different types of things to kind of make collagen work. We need adequate amounts of vitamin C, need adequate amounts of magnesium, copper. There's plenty other things. We did a whole, I think, episode on collagen already, so I don't want to step on that. But there's plenty of ways you can get all the things you need without resorting to animal products. They're absolutely not necessary. And not only that, a lot of animal products are going to increase that acidic load, which is going to lead to more inflammation, could potentially keep that coming around. So going more plant forward is kind of a necessity if you want this chronic pain to go away and stay away. That's part of the process. Where'd I lose? I lost my notes. Okay. So there are some exercises you could do. So let's take that neck example again. I have headphones, but say one of the things that I'll recommend to my patients is, if it was me and I was having, carpal tunnel and I thought it might be coming from the neck, and a lot of times it is, I would take like a dish towel, I would roll it up, and I'll use my headphones here as an example. I'm going to put it behind the base of my neck, and I'm going to basically pull down almost toward your feet slightly. We're not yanking our neck, just enough to create tension, a couple pounds of pressure maybe. And we're going to look up. So I'll turn to the side and I'll do this way because I have a phone. So we're going to look up, up, up to start restoring that curve in the neck. And this is something very easy. Like you can do it every day. If you could get like 100 reps in, that's fantastic. You could break it up, do 50 in the morning, 50 at night, to start restoring that lordosis curve in your neck. That's going to be a start. Now there's other things you can do that we'll talk about for different things, but that's one. You could do a similar thing. Say if you're lying on your stomach, you can actually extend your neck and almost put your hands under your chin. So say like if I was watching TV, I'm not lying down right now and I can't really share my screen. But what you can do is kind of like almost lie prone and then kind of push your chin up. And that again is going to encourage that lordosis, that extension in the neck. So that would be something that you want to do. If you get dizzy, go slower. This isn't a race. We're not going up and down like this. So go slower. If it is something you continue to get dizzy with, then there's something deeper either in the vestibular system or something that we kind of have to address. For the low back, there's other things you can do too. So if I was getting similar pain to what we call carpal tunnel, would be like sciatica in the lower extremities. And what I would do with that is take a weight of some kind and strap it to my foot. And I would stand, and I can't, again, it's tough to demonstrate, and I don't have a picture that I could really share. And I would essentially just dangle that leg and just swing it back and forth, not aggressively. It's not active. We're standing on an elevated surface, and it doesn't need to be high, maybe like a foot. You're going to have the other leg kind of off and just going to dangle. And that distraction will help take some of the pressure off the pelvis. It's really great for like sciatic type stuff to start doing that and can be really helpful. Another thing that can be really helpful is taking a chair, like your standard chair, and turning it around and sitting backwards. So you have the back of the chair essentially at your chest, and your legs are spread around the chair. So almost like you're sitting like a cowboy or a cowgirl. That can help too. Sitting on a ball can do it. Can be helpful for this too. That's why you'll see medicine balls occasionally. But getting some of that distraction will take some of the pressure off of that. There are also some great books. Treat Your Own Back, Treat Your Own Neck by Robin McKenzie. I highly recommend them. They're like $10 each. Super straightforward. Treat Your Own Back, Treat Your Own Neck. I believe that's the names of them. Super straightforward. Shows examples of some of these exercises and also those extension ones, which is really important. If there's inflammation again, say like a bursitis, shoulder bursitis, hip bursitis, knee. Again, the reason there's inflammation in these tissues is because there's either poor nerve supply or poor blood supply. Have to go back to looking at the spine, have to go back to looking at the health of the blood. What does that mean? What's going on with our kidneys? What's going on with our lungs? What's going on with our liver? What's going on with our gallbladder? All of those things, the liver especially, like it has to detox and cycle through, clean this stuff up. Our spleen. If the blood is not clean, if it's thick, if it's in inflammatory state, if it's acidic, all of these are synonyms going to be an issue. And it can lead to, again, to a bursitis, an inflammation of the bursa sac because it's not getting the nutrients it needs from the bursa. Because what is the fluid inside the bursa sac? It's just a super filtrate of blood. It's everything in the blood except the red blood cell, or a lot of the stuff in the blood except the red blood cells themselves. So if the blood's healthy, then the interstitial not healthy, then the interstitial fluid isn't going to be healthy. You ultimately get inflammation. So next question usually get like, what is the best thing to do? Should I use ice? Should I use heat for short-term, relief? Generally speaking, heat is going to be good. I would say ice for acute injuries. So, and that would be like the neck, low back. Generally speaking, they'll go with heat if it's more chronic. Heat's going to be more helpful. You usually get deeper penetration with moist heat. So like a hot towel versus dry heat. Jacuzzis can be helpful for raising temperature. You could use things like ultrasound, which is great for scar tissue. I personally have never been a big fan of stim machines. They might help with pain relief intermittently, but they're not things that I tend to love. But that's when I would use heat versus ice. So hope that makes sense. Turmeric can be really, really helpful. A great, natural anti-inflammatory for sure. Can be really helpful. Some other topical herbals that you can use for pain relief, in the short term. White willow, I talk about. Salagesic by MediHerb, one of my favorites. Turmeric, we just talked about. Cinnamon's fantastic. Boswellia. I love the frankincense essential oil, especially topically. You can use that with, coconut oil and apply it to whatever areas. Again, will help with reducing the inflammation, helping relieve pain. Great as like a short term. I think I put the link to the essential oils I like in my story today if you want to check it out. But the frankincense oil can be really, really helpful. Warm compresses can help. You can alternate warm and cold too to kind of help with that blood flow. So that can be another really useful tool as well. So those are like the physical parts. And just some examples of how we go through, neck pain, back pain, or even extremity pain and how that relates to where those nerves come from. Because again, if there is, a blood or nerve supply issue, we have to go back to the root and start with that. Now, again, we talked about some of these, but what are some other things that can add to that inflammatory role? Most cosmetic products and fragrances we know are endocrine disruptors going to add to that toxic load. Artificial color and dyes, a lot of these actually contain heavy metals, and will deposit in usually fat tissue. SLS is a big one. This is found in a lot of personal care products that foam. It's actually in a lot of toothpaste. This damages cell membranes. It's associated with hair loss, believe it or not. It's very commonly found in shampoos. Propylene glycol. This is actually found in, again, a lot of styling gels, body lotions, shampoos, creams. This is something you'll actually find in antifreeze. So if you don't want that if you want antifreeze in your body, consider finding cleaner products. What else do we have here? We have polyethylene glycol, which is another one associated with cancer and aging and skin. It's found in a lot of cleaners, but also it can be found in other body products that you would use. We have monoethanolamines, diethanolamines, and triethanolamines. These are all known to be associated with cancer. Triclosan, which is crazy. Again, something that is a known endocrine disruptor, known to decrease fertility, and damages most organs in the body. Fluoride is going to be another one too. So, get a water filter if you don't have one already. Use a non-fluoridated toothpaste. Uh, it's think about this here. If there's a child warning, a label warning on it, on your Colgate toothpaste or Crest, and it says, "Oh, you can't swallow that. If you swallow this amount, go to the emergency room." Why would it be in amounts like equal to like 16 ounces of water, tap water? Something to think about. Um, I'm not going to say much more than that because I know I've gotten in trouble on that specifically. So, um, something to keep in mind, something worth looking into. So, where do we go from here? So, that's how we deal with the physical component. How do we start cleaning the blood? Well, one is we have to start cleaning, helping the liver, supporting the liver, because that is going to be what's cleaning a lot of our blood. Liver needs a lot of different nutrients to kind of help with that. Um, it's a lot of different B vitamins. You're going to need your antioxidants like vitamin A, C, and E, like selenium, like magnesium, like zinc. In the actually library, I'm going to put a list of the best sources of all foods for these things, so you'll be able to find them for free. I don't want to go into each of them now, but supporting that, what's going to be really easy, sulfur-rich foods, garlic, onion, cruciferous vegetables, all going to be fantastic choices. A lot of cleansing, hydrating. Citrus is going to be fantastic for that. A lot of fruits are very astringent. So, water-rich ones are going to be great. Berries are going to be fantastic. Herbs and spices, by definition, are generally going to have higher antioxidant potential. So, using a lot of herbs, particularly when you cook, is generally going to be very helpful for the liver. So that's one way I would go about it. And then again, cleaning out the blood. So, when I'm using this, when I'm looking for liver support, I'll get folks, even if it's with joint pain, we're starting on, like a 30-day cleanse that like we started with before. Sometimes we push it to 60 or 90 to kind of see as we're feeling. Along with, again, the physical component. What are we doing? How are we going to get about it? We can include, depending on what's going on, different antimicrobial remedies. Maybe like a black walnut, maybe like a golden seal, maybe something like that or clove or oregano oil or some sort of antimicrobial, perhaps even a silver, depending on what's going on. Tough to say. But if there are signs which you could pick up physically on the tongue, on the fingernails, in the eyes and the iris, if there is evidence for maybe perhaps doing a cleanse, and I recommend doing a cleanse, I would say at least twice a year, if not seasonally. for blood sugar issues or candida or yeast that are going to cause more inflammation, it's something really worthwhile to consider. Some other herbs that you might want to add are things like dandelion, milk thistle. Anything bitter is going to be really helpful for the liver. Licorice, artichoke, the burdock, yellow dock, calendula, schisandra. I personally like burdock complex by MediHerb because it's great for lymphatic support as well. Livton and Livco are great. Dermico is great. All those are going to be great for liver and also lymphatic system support. On top of going through kind of a 30-day protocol, that's where I would say start. Um, and then you kind of go from there. We have to eliminate the stuff that's going to be the triggers, the processed sugars, the seed oils, the dairy, the where was I going? The glyphosate, the excess antibiotics and injections potentially given to animals that we end up consuming. Um, all these are going to just lead to that load, along with the other things I talked about. Perhaps you might have to do some binding, right? I talk about the zeolites. So I like Cell Defender. You can check it out here. This is my favorite one that I use with a lot of folks I work with, and you get some incredible results with that to help get some of these toxins out. A lot of times with joint pain, it can be coming from heavy metal exposure, either through dental procedures or just, again, using a lot of the products we talked about in the past. So that would be where I would start. There's a lot of different things that go along with it. If you want to get started with me and try one of these things, let me know. There's going to be support available in the new inner circle if you want to try these, and I could support you literally through it. Or you could get more of the one-on-one attention you want with me in an even smaller, container. So that's what we got for today. Control the controllables. A lot of these are very controllable, and there's a lot you could do. Thank you for hanging out with me today. Much love, and I will see you guys next time.